British Sign Language Scotland Act 2015 Inquiry Report. Summary. The British Sign Language Scotland Act 2015 marked a significant milestone in promoting the use and understanding of BSL across Scotland. A decade on, the Equalities, Human Rights and Civil Justice Committee conducted an inquiry to assess the Act's impact, the effectiveness of national and authority plans, and to identify areas for improvement. Background and legislative framework. The BSL Scotland Act requires Scottish ministers and listed authorities, for example, councils, health boards, educational institutions, to publish plans every 6 years detailing how they will promote BSL. The first National Plan 2017 to 2023 set out 10 long-term goals and 70 actions across sectors like education, health, transport, and justice. The second National Plan 2023 to 2029 includes 45 commitments aimed at embedding BSL across public services. Evidence gathering. The committee received 37 written submissions and held formal and informal sessions with stakeholders, including deaf organizations, public authorities, academics, and BSL users. This engagement work provided valuable insights into lived experiences and the effectiveness of the Act. Impact of the Act. Stakeholders widely acknowledged the Act's positive impact in raising awareness, increasing visibility of BSL, and empowering deaf communities. Initiatives like Contact Scotland BSL, a 24/7 video interpreting service, were praised as transformative. Examples of improved service access include better interpreter support, deaf awareness training, and inclusive recruitment practices. The first national plan was widely praised for the collaborative work that had gone into it. However, concerns were also raised about inconsistent implementation, lack of enforceability, and insufficient funding. The shortage of qualified interpreters, especially in rural areas, remains a significant barrier. Second National Plan. Mixed reception. While the second National Plan was welcomed for its ambition, many stakeholders felt it lacked measurable goals, timelines, and accountability. Some contributors to the consultation process expressed disappointment that their recommendations were diluted or omitted. Stakeholders called for clearer targets and better resource allocation. The committee regretted that the collaborative spirit of the first plan was not fully carried forward. It recommended greater transparency and stakeholder engagement in future planning. Authority plans, progress and challenges. Listed authority plans showed varied levels of engagement and effectiveness. Positive examples included Dundee City Council's extensive consultation and NHS Forth Valley's co-development approach. However, some authorities were criticised for a lack of engagement with BSL users, tokenistic inclusion of deaf-blind people, and lack of accountability. The committee highlighted the importance of maintaining dedicated BSL roles and called for best practice sharing to improve future engagement with deaf communities and other partners. Monitoring and accountability. Monitoring of both national and authority plans was found to be inconsistent. Only 62% of listed authorities had published BSL translations of their plans by the statutory deadline. The committee invited the Scottish Government to consider requiring 3-year progress reports and ways to improve data gathering, to better understand the needs of different BSL user groups. Suggestions were also made to establish a national oversight body, similar to Bord na Gaelic, to enhance accountability and funding transparency, which we have invited the Scottish Government to respond to. Education and early years education emerged as a critical area. Stakeholders stressed the need for qualified deaf BSL teachers and role models. Many deaf children enter school without a fluent language, impacting their development and future prospects. The committee called for investment in early years BSL education and increased numbers of qualified teachers of the deaf. Mainstreaming was criticized for isolating deaf pupils. The committee was sympathetic to the idea of deaf units or resource-based schools to bring deaf children together and foster identity and inclusion. It also recommended expanding BSL learning opportunities for hearing pupils. Cochlear implants and language choices. Concerns were raised about over-reliance on cochlear implants and speech therapy, which can marginalize BSL and affect deaf identity. The committee advocated for balanced language choices and better support for families to learn BSL. Justice. Access to justice, especially for deaf survivors of domestic abuse, was a major concern. Stakeholders highlighted the lack of accessible information, interpreters, and deaf-specific services. The committee called for better education about legal rights, more trained deaf advocates, and improved data collection. The committee also heard about the challenges BSL users can face when contacting emergency services when interpretation isn't routinely available. Court proceedings posed additional challenges. The absence of BSL intermediaries and exclusion of deaf people from jury service were noted. The committee welcomed legislative amendments to address the jury service issue and urged further action to support deaf participation in the legal system. Healthcare mental health services for BSL users were deemed inadequate. Stakeholders called for more deaf mental health professionals and better training for healthcare staff. The committee recommended alert systems for emergency services, improved interpreter access, and greater understanding of deaf identity and tactile BSL. Concerns about services for older deaf people and those with dual sensory loss were also raised. The committee urged the Scottish Government to ensure appropriate care packages and to increase the number of social workers for the deaf. Transport and rural access. Rural BSL users face compounded challenges due to limited services, transport barriers, and isolation. The committee welcomed technological solutions like online interpreting, but emphasized the need for digital literacy training and infrastructure whilst noting that online interpretation isn't ideal for all BSL users. It also called for accessible transport information and incentives for professionals to work in rural areas. Contact Scotland BSL. The Contact Scotland BSL service was widely praised, but concerns were raised that it had faced risks of closure. The committee welcomed assurances from the Scottish Government about continued service provision and the appointment of a new provider. It also recommended a formal evaluation of the service to ensure it meets user needs and maintains high standards. Conclusion and recommendations. The committee concluded that while the BSL Scotland Act has delivered meaningful progress, significant challenges remain. It made several recommendations, including strengthening monitoring and accountability mechanisms, improving data collection and disaggregation, supporting training and employment of deaf professionals, ensuring equal respect for BSL users and tactile BSL users, Investing in early years education and rural access. Considering the establishment of a national oversight body. The committee emphasized that BSL must be recognized as a language and culture in its own right. Future efforts should be shaped by the lived experiences of the deaf community, with a focus on inclusion, empowerment, and equity. The committee expects to hold a parliamentary debate later this year to discuss its conclusions and recommendations along with the Scottish Government's response to them.